Karen Haines, where are you? Here comes Karen. Now, Karen is a survivor. Up again. 1 year.
1 year.
You know, people, I know you're walking around going, oh, I like that magic number 10, I like that magic number 4 or 13 on there. But I tell you, it starts one day at a time. It's kind of like an intervention program. But it really is when I hit the 1 year mile after I told I was 6 months, I couldn't believe it. So I'm really interested in hearing your story. Relax. You'll survive. You okay?
Yep, fine.
All right. Here we go.
Deer in the headlights, but I'm fine. When I woke up this morning, I thought, I must be out of my mind. I said yes weeks ago, and I guess it was a weak moment to Heather. But anyway, here I am, and I'm happy to be here. Happy to be here to meet you. I want to thank Kidney Cancer Canada for asking me to share my story. And I also want to thank my sister, Brenda Kerr, for coming with me today and being here. She's been through it all with me. So thank you, Brenda. Yeah. So my story, 1 year, but I want to go back to 2013. I was nearing the end of a 10-year kind of plan in my life. I wanted to go back to university and get a couple of degrees. I wanted my nursing degrees. I wanted a master's degree. I wanted to change the focus of my work a little bit. But I came home one weekend to visit my parents and my oldest brother who has Down syndrome, and I realized that they were not doing well. They were in Brantford. I was in London doing my own thing on my own, and they were at risk. So towards the end of my master's program, I decided to move home, buy a house, and move the three of them in with me and take care of them. Nurses are known to do, things like that. They don't have a lot of common sense. Also, nurses can be known to be the worst patients ever. Dr. Pfeiffer, what do you think? Okay. So we did that. We moved into this place that I bought, and I got into gardening. I was like, this is so much fun. And I hurt my back. And I went to the doctor, and he said, we should do an MRI just to see what shape your back is in. And after the MRI, he phoned me up in a couple of weeks, and he said, your back's getting old, like you are. Okay. And he said, all those disc problems and whatever, but no, surgery's not recommended, and basically just live with it. I was like, okay. He said, but before you hang up, I just want to tell you that they saw something on your kidney. And, it's probably, maybe nothing. And I think we should just maybe monitor it for 6 months. It's not very big, I don't think. And, but, come see me in a couple weeks and we'll talk about it. Well, I'm a nurse. And something on my kidney. I'm into the computer within seconds. Stupid. And yeah, onto Western's website so I could get access to the latest articles. And boy, did I do that. By now, my back was so sore that I was off work, so I had time. And I pulled up every research article that I could find related to anything to kidney. Yeah, it was bad. And I sent my anxiety sky high. I really did. I didn't have an appointment right away. I had to wait a little bit. I went to see a kidney specialist. I had a CT scan in that time and wondered if this tumor that they found in my left kidney was transitional cell carcinoma. It kind of looked like it could be. It was right in the pelvis, and it was less than 3 centimeters. And he did a ureteroscopy and put a stent in to keep the ureter open because he'd been a little traumatized, and sent me home and said, I don't think it's transitional cell. Doesn't look like it. Probably renal cell carcinoma, but there's a possibility it's benign. So I'm thinking, we're reading everything still. And the plan, so that was November of 2014. The plan was to take the kidney out. He said, maybe February or March, because there's a lot of sicker people in line waiting for surgery. And I'm thinking, well, if it hasn't metastasized, he said it doesn't look like it's anywhere else, then I wanted that thing out. And I'm pretty sure everybody would want the same thing. I don't know. I didn't want to monitor it. I'd seen too much in my travels. So that was the thing in my mind. I want this thing out. And I went to my family doctor again, and I said, could I see someone else that might be able to give me a different idea on treatment and sooner, whatever. And he got mad. And he said, if you ask me for another referral, you can find yourself another doctor. I will give you the referral. So I got a referral, and I went and I saw Dr. Pfeiffer at Credit Valley Hospital, who removed my kidney in January of 2015. I had a laparoscopic surgery, and I went home the next day, and I was, kind of sore and tired for quite a while. The pathology report didn't come back as quickly as I thought, and the appointment was delayed a little bit. And when I did go back to see Dr. Pfeiffer, I had myself convinced by now that it was benign, so I didn't take anybody with me to the appointment. And I walked in, and Dr. Pfeiffer started the conversation with, unfortunately, and that's one of the things you don't want to hear from your oncologist. And he just told me it's a type of renal cell carcinoma called oncocytic papillary renal cell, and it was small, but it had already gotten to stage 3. So I was really glad I had pushed personally and advocated for myself and found a new GP. He was a family friend, too. It was bad. But anyway, I got this diagnosis, and the thing was out. It was taken out. It was encapsulated, and I was delighted. Yeah. And the pathologist was Dr. John Shrigley, who's quite expert in the area of papillary kidney cancers. I had some genetic testing done. I wanted to know if it was something that ran in my family or if there was anything else that they would learn from that or could help me with. The results from that came back with no mutations, so that was another piece of good news for me. Receiving the diagnosis was pretty horrible that day. I remember, hearing Dr. Pfeiffer tell me, but I don't remember anything else until I got to the counter at the front where the nurses were, and everything went black. And I had to sit down for a little while because I was just so shocked. It's different when you're a nurse and you're working with your patients. It's all fine and dandy. I can see all kinds of gory things, and and when I was in that type of nursing, it didn't bother me. But when it comes home to visit to you or one of the people that you love, it's like, wow, this is big. I think you probably all know that feeling, that anxiety. I work with people on a daily basis, helping them. People who have experienced trauma, I help them with anxiety. It is not the same when it's you. What I did after I got the diagnosis was I quit my job. I was in a position, a clinical nurse specialist position in medical psychiatry. It was a busy, stressful, long-hour position. I was walking all over the hospital all day long, and I was tired and I was in pain, so I can't go back to that. This is like a big ball of stress all at once for me. So I decided to quit, and when I did decide to work to the next job, I wanted to take fewer hours and a position that fit me better. And so now I work, and I have done this part-time for some time, but I work as a nurse counselor and trauma therapist. I have a couple of jobs. One's a private practice, and one is part-time in a physician's office. It's delightful. It's my thing. I love it. The business is growing. I still have my parents at home to care for. I have support from my siblings. And it's really neat, what you learn and what you learn about your family. I kind of knew my family loved me, but wow, did it ever explode when they, started to support me and were with me through this part of the journey. When I went back for my 3-month checkup, I had a scan and went back, and it was clear. And then I was to go back in another 6 months after ultrasound and chest X-ray, and I couldn't get there. I got in the car, but I found my anxiety go sky high again. And I got nauseated, and I was having hot and cold sweats, and I thought, oh, I got the flu. As soon as I phoned to cancel, and then I realized I don't really feel that bad now, so maybe I'll go to the mall. And I missed my appointment. And then I put it off for still another month or two. I went back, and it was still clear. So I'll have a CT scan again. But the anxiety of living and not knowing what's going to come up next is there, and I admit it. A couple of weeks ago, I developed a really sore knee after, I'm getting old and I'm not in great shape, and I was down on the floor washing the floor on my hands and knees, and my knee swelled up. So I went to my family doctor limping, and she said, oh my goodness, I wonder if the cancer's gone to your knee. And if it has, we're going to have to book bone scan, and blah, blah, blah. I'm like, I didn't even think of that. And so then, a week of anxiety, and the doctors that I work with booked me an MRI, and I had it almost right away, and found out I had on last Saturday night, my knee is kind of bad. And yeah, I didn't think of cancer, so I went, and the results came actually on Monday to our office, and I opened up the computer, and it said, you have arthritis in your knee. It's really okay. So then the level of anxiety went down again. It's a ride. It's definitely a ride. Thank you very much for listening to me. I'm doing fine, and I really, really appreciate being here today.